Now, I know I look like I've come up here with wadges of paper, but I promise you I won't be overrunning, except there's no clock at the back. Those of you that know me know I can and will talk for Wales, which is clearly why Judith put me on right at the end when you're all going to start fidgeting. So this is good. I think I want to just start by thanking Judith and the entire team, because what an amazing day. I've just been asked to do some closing remarks and just pick up a few reflections. And, do you know, wow, I've only been in this post 3.5 weeks. I've been to quite a few all AHP events, and the stuff that we are doing is phenomenal. It is absolutely amazing. The difference that we are making to people's lives across Wales is incredible. The way in which we share and work together as a group is really different to how some other professional groups work. And we really, I heard Linda say shout loudly. We have to shout loudly about what we do as individual professionals, because it is absolutely unique and different to each other. But we also have to shout loudly about how good we are at working together. And I've really heard that today. In the 2 workshops I've sat in, it's been about collaborating. Lovely phrase in the second workshop about activating our staff. That sense of excitement and motivation and ability to make a difference is really phenomenal. So having said something nice, I'm just going to tweak towards, please don't all go to sleep, but I'm just going to mention, anybody read it? Yay! Okay, so here's my challenge to the rest of you. This is what will put you centre, top, front, underpinning, bottom, foundation, and the absolute skylight of health and social care. You need to have a look at it. Honest, it's not boring. I know I'm a policy geek, but it isn't boring. It's really powerful for us. And all of our professional bodies went to give evidence to the parliamentary review team. In fact, we went together. And the really nice thing, and Pip is in the room, she'll bear this out, but your policy officers all went together and really went in with a clear agenda. Who knows what the title of this is? Pip's not allowed to answer because I know she knows this is a... Who knows the title? Say again? Revolution from within. This is your opportunity to really change things. And I think that is such an agenda for public health, because what this is about is a seamless service. It is about a seamless system for people. It is about putting the person at the centre of everything that we do. It is about really driving value-based care. And if there's one thing that you can attach to really sell your ideas, it's putting that label of value-based care. And that's what we do. We deliver added value. We make a difference to people's lives. When you read it, it talks about underpinning this transformed system. I mustn't say service. System is the whole point. System with what's known as the quadruple aim. Okay? So there's 4 elements to the quadruple aim. I do know them, but I have to give away the fact that I'm going to check them by putting the glasses on. It is about population health and well-being. It is about absolutely making a difference to every single citizen here. It is about the impact that we have on population health and well-being. It is about the quality of that care and the quality of experience that our service users, clients, patients, people that we work with experience. Not just them, their families, their carers, their friends, and everybody around them. And we deliver a quality of experience. We're well used to working co-productively. We're well used to working with individuals. And we're well used to working across whole systems and making sure that everybody supports that person and their networks to have the best life that they can. The quadruple part of the aim, used to be called the triple aim for those of you that have heard it, is the addition of the well-being and health and of the social... It's the end of the day. The well-being of the health and social care workforce. And that's about us. And we've had lots of presentations today. I was in a workshop before lunch about how we're making a difference to what happens to our staff. It is about making our staff feel valued and empowered and making sure that, in prudent terms, they're working to the top of their licence. Boy, can we show some other staff groups in health and social care how to do that. So we need to go out and sing that loud and proud. And the final one is about delivering best value for money. And we cannot forget that there is a limited resource. We have to understand the cost, the opportunity cost, and the value of what we're doing, and to be able to demonstrate that we are reducing waste and making the biggest difference that we possibly can with our scarce resources. So those 4 elements, thinking about value-based care, thinking about quadruple aim, that is your gift. Somebody is handing you the power in Wales to get out there and make a real difference to public health, to make a real impact on the lives of the people we want to work with. It has to be about a partnership. It has to be about enabling people to begin or maintain as many healthy lifestyle activities as possible. So we all have to prioritise health promotion, prevention and early intervention. And I love that. Oh, it's up there. Marvellous. I love that little vote today. But what a message we need to take away, that we don't believe that every AHP thinks they have a public health and promotion role. That maybe has to be our first step. Tomorrow, get out there. What is it that you need to do to make sure every single one of our colleagues understands the importance of being focused on improving public health? Making every contact count is important. It's not the whole story, but it's a really important part of it. But there are lots of other things that we have to do. And part of that has to be about sharing our knowledge. It has to be about handing power and control to the people we work with. Because the other words that we see in policy are around self-management, are about people being motivated to do what helps them live the life that they want to live. We can't do that if we treat them as babies. We can't do that if we control all the information. We have to pass that information to them. We have to work in full partnership with them. And we've got a real opportunity to do that. I'm 4 weeks in post, so I'm standing up here like I know something. I know nothing. I've been really blown away by the quite amazing things that we're doing. But so few people outside of our professions understand us and know what we're doing. So we really do have to get out there and shout loud and proud about it. So that's a request from me, really. One of the things that I found, as Judy said, I've come from working in a member organisation where those in the room who are in my professional body, I really apologise, were used to me going, tell me what you're doing, give me the information, give me the evidence. Why haven't you told me about that? Why haven't you published that? We all need to do that. We all need to make sure that actually those people who speak on our behalf, your executive directors of therapies and health science, your directors of public health, your therapy managers, the people that you work with understand what you've done and what the evidence is of that. And this kind of event is fantastic. It's the third one I've been to in 3 weeks, and each one of them has been brilliant. But the people in the room are ourselves. So we actually need to get the message to other people as well as ourselves. So go out from here and actually make sure other people than AHPs hear that evidence that we've gathered. I did warn you I could talk forever. Sorry, Judy. Thank you so much. I look forward to working with you all.